The healthcare system in America is an inefficient, ineffective, technology-driven machine with the soulless purpose of generating profit, at times to our detriment of our physical and collective health. So this is healthcare in 3 questions. Which one of the 3 questions do you think dominates the landscape? Yep, money. What I would like to present to you today is that we as a nation spend more money on healthcare both publicly and privately, and yet lag all other wealthy nations in the world in terms of outcome and quality. I'd like to make the case today that rediscovering relationships in healthcare is the primary solution to our healthcare problem. That connection can actually save our souls from the healthcare machine. For the last 150 years in America, healthcare providers have been paid for just the sheer number of things that they do to a patient. So if you order more MRIs, if you do more surgeries, the more money you make. Health insurance companies tally record profits while simultaneously cutting payments to providers and shifting more of the cost of care to the patient in the form of higher copays and higher deductibles. Healthcare providers are forced to see more patients in order to meet the bottom line. And inevitably, the quality of that interaction, it suffers. With productivity expectations looming and with incentives to control certain comorbid diseases like hypertension, diabetes, and asthma, the healthcare provider arrives at the primary care visit with their own agenda. A study of doctors at the Mayo Clinic indicated that within 11 seconds of speaking, the doctor had already interrupted the patient. And 2/3 of the time, never even bothered to ask what the purpose of the visit was. So the longer you work for the healthcare machine, a bit of your soul dies each year, with expectations looming to produce more revenue, happy patients, treatment success. They ratchet up more and more each year. You take home hours of paperwork just to keep up. In my profession, exactly none of us went to 7 years of college to end up stuck in this machine. We all universally said in our grad school interview that we just wanted to help people. A few years ago, I did some in-depth training in the UK that produced a seismic shift in my practice. It's a shift that fuels a joy that the machine cannot steal. And I'm very happy to share it with you today. I was taught how to connect with human beings, specifically those patients that were the most complex and suffer from chronic pain. Let's just say I know a gal. She was an elite ballerina. She had a scholarship to a New York dance school. She loved rock climbing, both indoor and out. She was young and life was full of potential. Like many chronic pain patients, her pain started after a time of unprecedented loss and stress in her life during her high school and college years. She fought and survived breast cancer, but only after losing both breasts to mastectomy. While she was searching for answers to her chronic fatigue, fibromyalgia, irritable bowel syndrome, she was misdiagnosed with Lyme's disease. The doctor started her on an extended course of strong antibiotics that left her body both ravaged and weak. So severe were her symptoms that she spent many days bedbound, traveling only by wheelchair, and spent 10 years of her life on disability. So for the past 20 years of her life, she searched for answers and effective treatments to her chronic pain. She's seen numerous doctors, had multiple treatments, and has yet to reclaim her former life. While interacting with the healthcare machine, she's wasted countless visits, countless dollars, and she's avoided some disasters, but she's also suffered a great deal needlessly. A severe neck pain brought her to see me in physical therapy about 8 months ago. During that time, she has made a remarkable transformation. I would want to share with you today the significant differences that she felt were meaningful in her care. I listened to her, and I did not interrupt. I heard her past strength as a ballerina and as a rock climber, and I also heard the negative interactions that she's had with healthcare providers. I stuffed my agenda to meet my patient where they're at. Instead of her feeling aggression from me, she felt safe. Safe to have a bad day. Safe to come in with her homework not done. Safe to share the true barriers to her progress. I gave her practical ways that she could calm down her nervous system and care for her own body for once. I helped focus the treatment on simple tasks that would give benefit to her life. All she wanted to do was simply sit on the floor and play with her kids comfortably, to be able to put on her shoes with a little less difficulty. I created a safe place where she could cry and grieve the years that she lost and her lost potential. But more importantly, I connected her to her joy, ballet. We just had her simply modify it temporarily until her next symptoms calmed down. I too would have repeated all the other healthcare providers' mistakes and done her yet another disservice if I was in a production mode. The answers to the first three questions that we started with, research tells us, is in the building of a therapeutic alliance with our patients. Therapeutic alliance indicates the level of agreement between the provider and the patient in regard to the goals of treatment, specifically what each person will do to achieve those goals, and the extent to which there is trust and connection between provider and patient. It is the single most predictor of treatment success for both physical and mental health problems, and is also an excellent predictor of adherence to exercise. Fostering a therapeutic alliance with your patients is the antithesis of the behaviors that the machine produces. For example, we have in-depth and extended conversations as to the nature of chronic pain, its triggers, and why it persists. We have a flexible format. At every visit, we collaboratively set an agenda based on her current needs and greatest barriers. Sometimes we break the rules. Evidence says that we should minimize the amount of passive treatments that we do for patients in pain. However, I know that a little bit of TLC goes a long way on a given day to engender trust with my patient, and it actually helps her rebound quicker. We engage in root cause analysis. We carefully weigh the relative contributions of the biological, psychological, and social factors that affect her pain. So that brings us to today. Now, I can't tell you that she has 0 out of 10 pain. I can't tell you that every day is perfect and she has no more problems. But what I can tell you, after 20 years of being frequently bedbound, traveling by wheelchair, she's back playing with her kids. She just ran 2 miles with her son. She's dancing twice a week. She rock climbs once a week. And now she's strong enough to do this on a paddleboard. There are still times that stress and pain get too much, so she runs the stairs to get a natural dose of endorphins to deal with that pain. So I've got to think, what would life look like for her if she had access to this type of care much earlier in her chronic pain cycle? At the point of postpartum care, post-cancer care, post-surgical care. At any of those points, she could have reclaimed function, pain control, and life. How much money could be saved on ineffective treatments and scans and procedures if we were all trained to deliver care in this manner? How much more of our own joy and purpose could we recapture as healthcare providers if we didn't work for the machine? Chronic disease and chronic pain in America are the most expensive problems that we face as a nation, but they can be remedied by effective training in the therapeutic alliance. So, pursuing greater connection with our patients, it actually does a few things for both provider and patient. We were able to find success where many other providers failed. My patient is happy with the care that she received, and she will advocate for many other people to seek it out. And yes, I got paid, but more importantly, I get to keep my soul. Thank you.